A stronger body is not built in a single workout, a single diet change, or a short burst of motivation. Strength, true physical resilience, comes from consistent daily habits that support muscles, bones, joints, metabolism, and the nervous system. A strong body is not only about appearance. It means better immunity, improved balance, reduced injury risk, healthier aging, stable energy levels, and greater independence later in life. The good news is that building strength does not require extreme routines. It requires structured, repeatable habits done daily. The first and most important foundation of a stronger body is sleep. Muscle repair and growth occur primarily during deep sleep. Growth hormone, which supports tissue repair and fat metabolism, is released in higher amounts at night. Chronic sleep deprivation reduces muscle recovery, increases inflammation, and impairs coordination. Adults generally need 7 to 9 hours of quality sleep. Maintaining consistent sleep and wake times strengthens circadian rhythms, which regulate hormone production, metabolism, and energy. Without proper recovery, even the best exercise plan will not produce optimal results. The second critical element is resistance training. Muscles grow stronger when exposed to controlled stress. This process, known as progressive overload, involves gradually increasing the challenge placed on muscles. It can be done with bodyweight exercises like push-ups, squats, lunges, and planks, or with weights such as dumbbells and barbells. Strength training stimulates muscle fibers to adapt, increasing both size and efficiency. It also improves bone density by placing mechanical load on the skeleton, which stimulates bone-forming cells. This is especially important as bone density naturally declines with age. 2 to 4 sessions of resistance training per week are sufficient for most adults, targeting all major muscle groups. However, daily movement is just as important as structured workouts. Long periods of sitting reduce circulation, decrease metabolic efficiency, and weaken postural muscles. Standing up, stretching, or walking briefly every hour improves blood flow and joint lubrication. Even low-intensity movement throughout the day contributes to total energy expenditure and metabolic health. Walking 7,000 to 10,000 steps daily, depending on individual capacity, supports cardiovascular function and endurance. Nutrition plays a central role in physical strength. Protein is essential because it provides amino acids, the building blocks of muscle tissue. Without adequate protein intake, muscle repair is limited. Most active adults benefit from spreading protein intake evenly across meals rather than consuming it all at once. High-quality protein sources include eggs, fish, poultry, lean meats, dairy, legumes, tofu, nuts, and seeds. The exact amount needed depends on body weight and activity level, but consistent intake is key. Carbohydrates are often misunderstood. They are the body's primary fuel source for moderate to intense activity. Whole grains, fruits, and vegetables provide carbohydrates along with fiber and micronutrients. These sources support energy production without causing extreme blood sugar fluctuations. Refined carbohydrates, on the other hand, can lead to rapid spikes and crashes, reducing performance and recovery. Healthy fats are also necessary. They support hormone production, including testosterone and estrogen, which influence muscle maintenance and bone health. Sources such as olive oil, fatty fish, avocados, nuts, and seeds provide essential fatty acids that reduce inflammation and support joint health. Hydration is frequently overlooked in strength building. Muscles are composed largely of water. Dehydration reduces strength, endurance, and coordination. Even mild fluid loss can impair performance. Drinking water consistently throughout the day supports circulation, nutrient delivery, and temperature regulation. Sweating during exercise increases fluid needs. Joint health requires specific attention. Strength is not only about muscles, but also about connective tissues. Dynamic warm-ups before exercise increase blood flow to muscles and prepare joints for movement. Controlled mobility exercises improve range of motion and reduce stiffness. Stretching after workouts may support flexibility, although its direct impact on injury prevention is debated. What is clear is that maintaining mobility supports long-term functional strength. Consistency in posture also affects physical strength. Poor posture places unnecessary strain on muscles and ligaments. Strengthening the core muscles, the abdominal wall, lower back, and hips, improves spinal stability and reduces back pain risk. Core exercises such as planks, dead bugs, and bird dogs enhance stability without excessive spinal strain. Recovery days are as important as training days. Muscle fibers need time to repair and adapt. Overtraining without adequate rest can increase cortisol levels, suppress immunity, and reduce performance. Alternating intense sessions with lighter activity days, such as walking or stretching, supports adaptation without burnout. Micronutrients are essential for muscular and skeletal strength. Calcium and vitamin D are critical for bone health. Magnesium supports muscle contraction and relaxation. Iron supports oxygen transport in the blood, and deficiency can cause fatigue and reduced endurance. A balanced diet rich in vegetables, fruits, whole grains, dairy or fortified alternatives, and lean proteins generally provides these nutrients. In cases of suspected deficiency, medical evaluation is important before supplementation. Breathing technique influences strength more than many realize. Proper breathing during lifting stabilizes the core and protects the spine. Exhaling during the exertion phase of a movement helps maintain blood pressure stability. Shallow breathing can limit performance and increase fatigue. Mental discipline also contributes to a stronger body. Strength training requires progressive effort, and improvement is gradual. Setting measurable goals, tracking progress, and maintaining realistic expectations prevent discouragement. Adaptation happens over weeks and months, not days. Another important nuance is body composition. Strength is influenced not only by muscle mass but also by the ratio of muscle to fat. Reducing excess body fat through balanced nutrition and regular activity can improve relative strength, making movements easier and reducing strain on joints. Hormonal balance affects physical strength. Chronic stress elevates cortisol, which can break down muscle tissue when persistently high. Managing stress through adequate sleep, relaxation techniques, and balanced workload protects muscle integrity and recovery. Avoiding harmful substances is part of building a stronger body. Smoking reduces oxygen delivery to tissues and impairs healing. Excessive alcohol consumption disrupts muscle protein synthesis and interferes with sleep. Minimizing these factors improves recovery and performance. Sunlight exposure supports vitamin D production, which is essential for bone strength and muscle function. Spending time outdoors daily can contribute to healthier bones and improved mood. Importantly, a stronger body does not require extreme dieting or punishing workouts. Sustainable routines outperform short-term extremes. Gradual increases in resistance, consistent nutrition, daily movement, and proper recovery form the foundation. A practical daily routine might include waking at a consistent time, brief morning sunlight exposure, a balanced breakfast with protein, regular hydration, short movement breaks throughout the day, a structured strength session or active walk, a nutrient-dense dinner, and a calming pre-sleep routine. Repeating this pattern most days creates measurable physical adaptation. Over time, these habits improve muscle tone, bone density, posture, coordination, endurance, and metabolic health. The body becomes more resilient to injury and disease. Aging slows in functional terms because muscle mass and bone strength are preserved. Strength is not built by motivation alone. It is built by routine. When sleep, nutrition, resistance training, mobility, hydration, stress control, and recovery align, the body adapts in powerful ways. A stronger body is the natural outcome of consistent daily choices that support repair, adaptation, and resilience.